Hi, everyone, and thank you for joining us for a micro class here that we're going to be offering from the Medical Society of the State of New York. Today's class is going to be on submitting formal complaints to the appropriate agency, and it is being done by the Payment and Practice Division. My name is Heather Lopez, and I'm the Director of Payment and Practice with the Medical Society of New York State. Looking forward to providing this information to you. So you're at a point with insurance claims where you have come across barrier after barrier after barrier, and it's time to submit a formal complaint because the insurance company is not adhering to laws or compliance or contracts. So we want to move forward with submitting to the appropriate entity. Some agencies request PHI, patient health information, to be de-identified on submitted documentation, but some requirements. So make sure you know if they would like it or they wouldn't like it. And if they do want it, you can simply send it as is. If not, you can simply just black them out. I'm going to go ahead and share now information of everything that's needed that will really paint a clear picture for the entity and lesson time with questions back and forth. You want to have your contact information, name, address, phone number, exact name of the insurance company or health plan, copies, not originals, of course, of supporting documentation, invoices, claim numbers, dates of service, explanation of benefits, health records, notes on communications with the insurance company, date of the call, name of the person you spoke with, phone number, reference number for the call, summary of conversation. You really want to be able to paint a very clear picture to them so that they understand what your issues are and what you are looking to do. Keep all copies of written correspondence between you and the insurance company regarding the complaint, emails, letters, notices, etc. Many times I can tell you on some of the recent claim submissions that I have been working on, I have quite frequently referred back to notes, dates, reference numbers, so be sure to keep that. And then a concise description of the issue, clear time of the events, medical services sought, exact issue with the insurance company, and requested resolution. Now we're going to get into determining the patient's type of health coverage. One thing that mssny has advocated for is to be able to make this a little bit easier for doctors' offices to identify so that you're not searching and searching. In the fall, there was a resolution that went forward that now insurance companies have to put on the account on the patient's insurance card if they're fully insured or self-insured. You'll probably start seeing those with the new cards that have been issued as of 1/1. And thanks for all the folks at mssny that worked very hard to get this done, because it will certainly save a lot of time for us. So commercial coverage, there's two types: fully insured and self-insured. Fully insured, the employer and the employee pay a monthly premium, and the insurer takes the risk that the costs and the benefits will be less than the premium. Then you have the self-insured. Employer hires a third party, often insurer, to administer the health plan, but the benefit costs, including physician bills, are the responsibility of the employer. Then you have public coverage, which is your Medicare, Medicaid, other publicly subsidized coverage. Now, each of these places, each of these insurances have the entity of a governing body that we're going to submit our formal complaint to. We want to make sure that we're submitting them to the appropriate agency. So the next slide is going to identify that. And I'll leave it up for a second so that you can take a screenshot or take notes, what have you. So Department of Health, you have the Medicaid managed care, essential plans, qualified health plans, Child Health Plus. Department of Financial Services, Medicaid managed care, commercial fully insured and no fault. Department of Labor, commercial self-insured. NGS, National Government Services, Medicare fee for service, Workers' Compensation Board, workers' compensation, and CMS, Medicare Advantage plans. I'll leave this up for just another second. But these are the governing entities that are governing agencies that have where you're going to submit your formal complaint. And they will look into it and they will come up with a resolution and get back to you. Make sure you keep the reference number that they do assign for further follow-up. If you don't receive a response to your complaint within 2 weeks, 2 weeks is more than enough time for them to get it and then, assign it to a case worker who's going to be reviewing it and then get back to you. So if you haven't heard in 2 weeks, that's an appropriate time to follow up if needed. Of course, if you have any questions or concerns while you're submitting this complaint, or you're just not sure if this is something, your issue is something that needs a formal complaint, perhaps another avenue, I'm always here for you. So you can call me, email me with your concerns, and we can review it together to see what our next steps are. So I'd like to thank you for attending this micro masterclass. And if you have any questions or concern, be sure to reach out to me. Thanks so much.